welcome in someone from OrthoVirginia. Today, it's Quin Sweeney, a nurse practitioner, works with spine surgeon Dr. Adam Kroll. Quin, thank you so much for taking some time out of your morning to chat with us. How you doing?
I'm doing well. First of all, go Dukes. I have the same hat. Big win last night, which was fairly surprising to me. But yeah, thanks for having me on.
Quin, we could start right there if you want. I mean, we could spend this whole time talking all things JMU. Are you a JMU alum, I take it?
I am a JMU alum, as is my wife. Yep. We try to go back once a season if we can.
Awesome. Yeah, last night's game took a little long. I'm running on fumes here this morning as I think we wrapped up at around midnight. I'll start there then at the top, because there was an injury in that game where there was a player down. And of course, you're not working with these athletes. It's just kind of talking about the expertise that you have on this subject matter. But it seemed to be it was a neck injury that kind of may have impacted the spine. They had to put him on the board, cart him off the field. It was a very scary scene last night with the Texas State game. But I'm always curious, how much does the neck kind of play in part to the spine?
Well, it's the most important part of our spine because all of our motor control starts there. So with a play like that, they're trying to ensure that the cervical spine is protected, and they try to immobilize the cervical spine before they do anything else. So you'll see somebody holding the helmet in the head and neck area, trying to get a cervical collar in place a lot of times. And it's all just a way to protect the athlete until they can have a little bit more further workup. So it looks scary and the optics are concerning, obviously, but it's more in an effort to make sure they're safe until they can kind of evaluate further.
Gotcha. We're joined Quin Sweeney from OrthoVirginia, nurse practitioner with OrthoVirginia. I'd love, Quin, if you could kind of explain what your role looks like as a nurse practitioner working with Dr. Adam Kroll.
Yeah. So my role, and I have a counterpart, Gino Felix, who's another nurse practitioner with us. The way it looks and the way that we've designed it here is that I work with Dr. Kroll both in the clinic, working patients up, seeing new patients, follow-up patients, post-op patients. But then we also operate together several days a week. So I'll be kind of right across the table from him, getting the patient ready for surgery and assisting him in any way possible. So we're kind of under the wing of the surgeon, but we have a lot of autonomy as well.
That's awesome. I'm looking at kind of spine injuries in athletes. What spine injuries do you see are common among athletes who play contact sports specifically?
For contact sports, even though you're thinking that maybe high trauma stress injury, it's really sprains and strains is the most common thing to think about. And you have other concerning injuries such as stress fractures, potentially disc-related injuries when we think about blowing out a disc or something like that, or disc herniation. And then lastly, and most concerningly, is your spinal cord trauma or injury to the cord itself. But that's very rare, obviously.
What does a spine strain or sprain look like or feel like?
Well, it feels like you've kind of thrown out your back, or just the muscle is tender and you're tight. You can't get loosened up and so forth. And it's pretty common, but it's you just have to be thinking about how to get loose and how to optimize your physical fitness and so forth to try to avoid those types of flare-ups.
How do you go about examining an injured spine when someone comes into you guys, they're saying they're having pain in their spine or something along those lines? How do you then go about examining that?
Well, it all starts with what is the story? Because I want to understand, what hurts, how did it come to be? Is it traumatic or is it degenerative? What's really the story? And so we kind of focus on that one particular area that they're hurting and start the exam there, looking at all of the muscle strengthening, any neurologic deficits? Do you have any altered reflexes or anything that kind of clues us into a bigger problem? And then most people here we're offering an X-ray to rule out any type of fracture or surprising feature.
Quin Sweeney from OrthoVirginia taking some time out of his Wednesday morning to chat with us. You mentioned it a little earlier, kind of sprains and strains are the most common. But which spine injuries may require season-ending, career-ending injuries? Because the spine is something that kind of is scary to sports fans when they see that their favorite player may have suffered a spine injury.
Yeah, I think, and this is rare, but the situation in which somebody may have a season or career-ending injury is typically going to be where they've insulted the spinal cord itself somehow. And many times that's going to be the disc being out of place and then putting pressure on the central cord. Other times, but rarely, is a kind of vertebral bone fracture that needs to be fixed. But you have to think about, what does the rehabilitation look like? And then what are the realistic goals of getting back into mid-season form, more commonly returning next season. But I've got two examples. So think about Peyton Manning, right? So he had a disc injury, which ultimately he required cervical fusion. Okay. So he's an athlete in a position who was able to return to form at an elite level and won a Super Bowl. Then you've got a situation like Chris Carson. You've got Seattle running back who was well loved there. Unfortunately, suffered a neck injury as well. And he was one that also required fusion surgery, but the demands of his role as a running back were such that he couldn't get back to an elite level with neck range of motion limitations and so forth. So it depends on the injury, it depends on the rehab, and then it depends on, what are you trying to realistically return to?
Quinn, I'm a Seattle Seahawks fan, and I didn't expect this morning to go down the Chris
I
Carson route.
know, I'm sorry, but it's a great example of how things can go different ways.
Yeah, I mean, there's kind of it's a little interesting. There's a longer list than most for Seattle Seahawks players. I think Cam Chancellor had his career ended due to a neck spine injury. Cliff Averill, the same thing, which was a defensive end. So we won't focus too much on what's happening over there in the Pacific Northwest with some injuries over there. I'd love to know what advances have been in technology, robotics. You're in the surgery room, so you're working with things like this, and you kind of hear about robots being used in surgery rooms. What advancements have you seen in technology that's helped you guys treat spine injuries?
So the first thing that starts is that OrthoVirginia is pretty fortunate in that we have on-site MRI and CT, right? So that kind of helps things from a preoperative standpoint get to an efficient diagnosis. Okay, then when we're in the operating room, we've got several interesting technology forms which help with patient outcomes. And I'm thinking about augmented reality, where we'll be using kind of special goggles to assist with seeing a live image of what the spine would look like. And then also there's other three-dimensional technologies where they'll do an intraoperative scan. And so that while we're looking at the spine, we have an ability to see where our instruments are in relation to that CT that we're looking at. So it's pretty neat in terms of advances. It's something I get pretty excited about.
That's so augmented reality involved, and that's insane. What's the learning curve like trying to kind of understand all of that and use that?
They'll put you through training. The people that we're working with right now will come in and put you through training and have you sign off that you're comfortable using the technology. But it's kind of, you just go slow about it. And it's like learning anything. You're training on a model, not on a patient. And then everything you're seeing, to be honest with you, you can look into the wound and also confirm what you believe to be on the screen or through your goggles. But it's very helpful in seeing a live image of what you're trying to work on.
That's awesome. I did not expect that answer to go that way. That's really cool.
Yeah.
Quinn, what are some other spine injury prevention strategies you recommend specifically for athletes who play contact sports to avoid having to visit you guys?
Well, so first and foremost, I always tell people that you've got to treat your preseason or your training very seriously, and understanding that that's going to gear you up for a successful season, making sure you're healthy throughout. So if you don't take that seriously, or if you don't play the preseason, such as our NFL athletes who are in contract negotiations and so forth, maybe you pay for it. Maybe you have a soft tissue injury or something of that sort, right? So that goes the same with the spine in the way that we can be concerned about preconditioning before the season. Now, also in the same vein, I think about contact sports. And when the fall, we're in the football season, we've got to understand how to avoid big hits, and also as young kids, how to tackle appropriately. So it really all starts there. Is if you're going to try to avoid blows to the head and neck, which is what we get most concerned about in the spine world, You've got to learn how to get down, or you've got to learn how to get out of bounds or slide when possible. And that's how you avoid some really big problems. So conditioning and learning how to avoid the big heads.
So I have no idea who you could be talking about in terms of contract negotiations in the preseason resulting in soft tissue injuries.
Mm-hmm.
So with targeting calls and things of that sort in the college game that we see more and more, that's something that is done to kind of in the end game, not only the concussion side of things, but also protect the neck and things of that sort.
Right. So unnecessary roughness, penalties. You've got hits on defenseless receivers. You've got changing the kickoff rules to ensure that we're avoiding these kickoff return injuries, which have been a big problem. So there's been a focus collegiately and NFL in terms of player safety, which is great. I like to see that at least.
Awesome. Quin, where can listeners go to schedule an appointment with you all at OrthoVirginia if they have spine injuries or spine concerns?
Yeah, so if you'd like to see me or any of my teammates, you can go to orthovirginia.com and search whoever you're looking for. So Dr. Adam Crowell, that's the spine surgeon I work with. You can look up my name, Gino Felix. And then there's a link there on the website, excuse me, through the physician's actual page where you can schedule from the website, or you can call the call center, and we've got a great staff to help get you with the right person.
Awesome. I love it. Quin, thank you so much for taking some time out of your Wednesday. Have a great rest of your week. And here's to some more JMU wins down the line.
Yeah, absolutely. Maybe some playoffs.
Exactly. Fingers crossed. Things got to break the right way, but I love it. Quin, thank you so much. Have a great rest of your day.
You too. Thanks a bunch.